Mentioned those two troublesome provinces. Aid group Gift of the Givers stepping in to help the provinces, the various provinces, deal with COVID-19 following an increase in hospitalisations in the Eastern Cape, the Western Cape and also KZN. How in the world are they doing it? The man in charge, the man who's coordinating all of this, always a pleasure, the director of Gift of the Givers, Imtiaz Suleiman. Imtiaz, good morning to you. And the question I led with there is probably the most obvious. How are you able to try and assist on a scale of this size? Congratulations, but just take me through how you're doing this.
Good morning, Gareth. Thank you very much. We had set up a plan early from 11th of March, before the President announced the first national emergency disaster on the 15th of March and before lockdown. We had identified a plan of action for the whole country, but said we will only act where the virus hotspots are. No point doing things in advance, but being ready in advance what has to be done. And the implementation was simple. We had to have teams already. As the virus count started climbing in the first phase, we realized Gauteng, Western Cape, Eastern Cape, those are the hotspots area, and to some extent KZN. We helped 200 hospitals and clinics nationwide with PPEs, oxygen machines, pulse oximeters, non-contact thermometers, scrubs, and we even did infrastructure. Now, in infrastructure development, we focused on the Western Cape and Eastern Cape, which has been a huge benefit right now. And in Mitchell's Plain, we took a disused building award and made a 10 million rand conversion into the building. It's a dedicated COVID-19 wing. It's full right now. I was in Cape Town last week, and in that work, they need more oxygen points. F-Fox will be there tomorrow. And then in the same complex, we saw the Western Cape Department taking 4 more buildings and preparing them to convert them into 50 patients each, so another 200-bed facility. And in there, we're going to be putting oxygen points also. Not all the buildings, some of the buildings. So we'll be helping with oxygen points in those buildings also. Then in the Eastern Cape, we took Settlers Hospital, and just to cut it short, we put up, we did infrastructure upgrade at 750,000 in 5 days. We made another ward available with high care oxygen points for 20 beds. We're busy right now in Bishop. We put up 120 beds there, and we're renovating a building for doctors' quarters so they can have extra staff to stay on site. My teams are working right now through the festive season to be ready in January. KZN has called the last 2 days, and it looks like they're going to need support also in various ways, but not infrastructure. And in short, we're putting PPEs in all these facilities, right now concentrating on Western Cape, Eastern Cape and KZN. And we've been fortunate. A huge bonus has come to us. CSIR has made what is called CPAP machines. We tested them out in Tygerberg, at Khayelitsha and Cape Town, and they're life-saving. We're starting to roll this out throughout the country. All the hospitals that need them, and the calls are pouring in. This thing is going to be life-saving. Doesn't use much oxygen. We can use it in ambulance, in clinics, at outpatients, in casualties, in ICU, and all the wards. And we're rolling it out, and they're already telling us these machines are saving lives, and we've got thousands of these machines.
This is obviously very good news for those who are on the front line of dealing with this, Imtiaz. There are going to be questions asked, of course, though, as fantastic the work that your organisation, Gift of the Givers, is doing. There are going to be critics that are going to suggest that you're having to now step in because government is not on top of this, and they were not on top of this from the beginning. What's your assessment of that?
That's been said from the beginning. It's not new. It's not news. It's been said from the beginning. And, our policy is always the same. We can't wait for government. Government, many people in government are very well-meaning. I'll give you an example. I had a mayor of one of the towns, I won't say where, came with me to the hospital. And everything we started implementing, and he was discussing with the hospital CEO. And after a while, he asked me, where's government? I said, Mr. Mayor, you are government. And he looked at me and he started laughing. And like that, they are well-meaning people. But the thing is, Gareth, we can't wait for policy and decisions and signatures, all that kind of things to happen. Because at the end of the day, it's the people that are suffering. So Gift of the Givers has always said, people come first. We're not going to wait for others to intervene. But by the same token, I must compliment the Western Cape government, and of course other hospitals and municipalities have worked very well with us and provincial governments. But Western Cape was an amazing example. We said we want to convert this hospital in Mitchell's Plain. In 4 days, we got 5 signatures. I spoke to Director Keith Kluki. I said, Mr. Kluki, Dr. Kluki, you guys will only take 3 months to 6 months to give 1 signature. To give 5 signatures in 4 days is a world record. And they started laughing. So like that, there is also many people within government who wants to work together, like Dr. Matiwane in Eastern Cape. We said, we need to sign an MOU with you ASAP, it must be signed tonight. So you do have those people who are keen to get things done.
Let's talk a little bit early 2021, perhaps the first quarter of 2021. I can't help but imagine, Dr. Suleiman, that we're going to be speaking to you again when it comes to the rollout of these vaccines, whatever form they take and however many they arrive here, because that seems to be the glimmer of hope for South Africa. But if the management of communication and the management of resources so far during lockdown has been somewhat wanting, I imagine that you're going to be involved come the rollout of these vaccines whenever they actually arrive in this country.
Well, Gareth, we are always available to help government in any rollout, with any kind of program. They just need to ask. Look, they made it clear we just fair to frontline workers first. So I'm sure they'll have to make an allocation for every hospital in the country, which shouldn't be complicated to do. And thereafter, of course, then it becomes complicated with the elderly and people at risk come second. But let's wait for that vaccine to come. My only worry is that I need to know from the virologist, I'm not sure about it, that will the vaccine still be effective for the change of strain? That's something that worries me. Because, when influenza vaccines in the past, sometimes you make them in advance and when the strain changes, it doesn't always work. I'm not saying the vaccine is not going to work. I'm just curious to know if it will work, what type of strain that we are affected with right now. And this strain is very, very aggressive. And I need to give a warning whilst we are to young people. A lot of young people think that it's the same like the first phase, that nothing will happen to them. They are fine, they're okay. I must tell you, a lot of young people are dying, 15 to 19 years old. Yesterday, a 32-year-old person died, young, fit, healthy, well-trained, well-exercised, no comorbidities, just dropped dead. The other thing is a lot of young, teenage, pregnant women also passing on. Children are dying and getting infected. So we have to take careful. It's not like the first strain. You can't be reckless. You can't be careless. You have to be, on watchful all the time.
Dr. Imtiaz Sooliman, I don't think anyone could have said it any better than you in that last statement. I always appreciate your time in speaking to us. A very, very busy director of Gift of the Givers, Dr. Imtiaz Sooliman. You can always go over to their website and see how you might be able to assist as well as we continue to all fight COVID-19, not just the first strain, but now the second strain as well.